Cardiogenic shock. Cardiogenic shock occurs when the vital tissues do not receive enough blood to function properly, and which may cause, if not treated properly, it may cause irreversible organ damage and death may occur. Underlying conditions. There can be many cardiac conditions which can cause cardiogenic shock to occur, such as myocardial infarction, myocardial ischemia, pulmonary embolism. It can be left ventricular failure or dysarrhythmia. Basic life support. Aggressive treatment plan is required to be implemented immediately to save the client's life and also to prevent the irreversible organ damage. To sustain normal blood pressure, maintain the client's airway, breathing, circulation, check blood pressure, heart rate, respiratory rate, oxygen saturation, and urine output. Obtain an ECG and connect the patient with the constant cardiac monitoring to observe cardiac changes closely and initiate oxygen at 15 liters per minute by using the non-rebreather mask if there is no contraindication present to use the oxygen. Then keep in mind that do not put the blood pressure cuff and the pulse oximeter on the same arm, because when the blood pressure cuff inflates, it causes vasoconstriction and which may alter the oxygen saturation readings. So keep that in mind. Next, we have cardiotonic drugs. Cardiotonic drugs are also called inotropic drugs. These agents have the potential to reverse the symptoms of the shock by increasing the strength of the myocardial contraction. First of all, we have dopamine. It causes the heart to beat more forcefully. It increases the cardiac output and it has a vasoconstriction effect and it raises the blood pressure. Dopamine is always given through the intravenous infusion, and the pregnancy category for dopamine is C. That means the safety for use during pregnancy and lactation has not been established yet. Tissue necrosis. Nursing to monitor the IV site frequently when infusing dopamine, because if it escapes into the surrounding tissues, it may cause tissue necrosis. And if extravasation occurs, stop the infusion immediately, restart at the new site, and then administer antidote phentolamine injections at the site of the infiltration. Adverse effects. Dopamine may cause hypotension and it may also cause dysarrhythmia. So whenever we are infusing dopamine, we should be watching the client for low blood pressure and dysarrhythmia. Digoxin. Digoxin, it increases the myocardial contractility. It increases the cardiac output. So prior to administering the digoxin, we should be monitoring the apical pulse for full 1 minute, and in children if it is below 70, and for adults if it is below 60, we need to hold the drug and notify the MD or physician for further directions. Digoxin level. Prior to administering digoxin, we need to review the serum digoxin levels. If the levels are greater than 1.8, hold the drug and notify the physician for further directions. Hypokalemia. Low potassium levels may cause digoxin toxicity, so we should be monitoring the client closely for these for digoxin toxicity and also for the low potassium levels. So we should be advising the client to include more potassium rich foods in the diet, such as patient may include bananas or apricots, peanut butter, beans. So these things patient may include in the diet to prevent hypokalemia. Toxicity. Early symptoms of digoxin toxicity in the children is arrhythmia, while in adults it can be nausea, vomiting, diarrhea, visual disturbances. And antidote for digoxin is digoxin immune fab. Then we have dibutamin. Dibutamin is also helps or used in the shock due to its ability to cause the heart to beat more forcefully, and it increases the cardiac output, and this is how it increases the assists in regulating the blood flow to the vital organs. It is beneficial in cases when the primary cause of the shock is um, heart failure. IV. Dibutamin is always given through intravenous infusion. Infiltration. If infiltration occurs, dibutamin can be very irritating to the surrounding tissues and veins. So, nursing to monitor the infusion site frequently and closely for any infiltration or leaking of the dibutamin into the veins or surrounding tissues. Daily weight. Check the client's weight each day as dose is required to be recalculated every day on the basis of the client's weight. So we should be checking the client's weight daily. Then the dose calculations. Dose calculations is required because the dose of the medication is based on the micrograms per kilograms per minute. So to know the ml per hour the client should receive, ordered dose is multiplied by the client's weight in kilograms, then multiply by 60. Why 60? Because to get the micrograms per hour. Grams per hour. And divided by concentration of infusion micrograms in micrograms per ml. So I'm going to repeat this formula again. To know the ml per hour client should receive, order dose is multiplied by the client's weight in kilograms and then multiplied by 60 and divided by the concentration of infusion in micrograms per ml. Then we have the contraindications to use the cardiotonic or inotropic drugs. First of all, these drugs are contraindicated if the client has high blood pressure or hypertension, because these drugs may further trigger or increase the blood pressure. Also, these drugs are contraindicated in the ventricular tachycardia because cardiotonic agents may worsen dysarrhythmia. Then these drugs are also contraindicated in the atrial fibrillation because a rapid ventricular response may increase the heart rate excessively. So we need to keep this in mind, all these contraindications. So that's all about cardiogenic shock. Thank you for listening.